will cover all three screens, and then the one that you feel most comfortable with will probably be the one that you use most of the time to enter in your charges. First, let's go over the online charge slip. Up on the toolbar, it's the second green button. If a little pop-up doesn't come up, you make sure you want to click in a blank area on this little screen here and then hover over it, and you'll get your title Online Charge Slips. Click on it. First of all, we're looking at the date of service, and right now I don't have any patients scheduled on December 9th. If they were, the time and their name would be listed over here for me to select and click on the charge boxes and diagnosis boxes. Now this is a charge slip that I started creating, and I only have one charge or procedure code box. You'll see up here the charge slip, and if I click on the arrow, I have two of them. You can have up to 3, 4, as many as you'd like. Be sure to select the appropriate one, standard, and you can see this is a more completed charge slip and more boxes to check. The top portion of the screen are the procedure codes. You can check on as many as you'd like, and then down below we have the diagnosis codes to check on. Let's go ahead and do one and pull up a patient. Again, this is not the screen that you'll want to post charges to a patient who's not entered in on the appointment scheduler. Now we're looking at today's date, but I know if I click on the drop down arrow, on December the 8th I have quite a few patients scheduled. Simply double click on the 8th and it'll pull up those patients. So Ben Franklin, I have him selected. It pulls up the provider who treated him, Dr. Kershaw, and then down below I can go ahead and check the appropriate procedure codes and maybe a few diagnosis codes. Now these little gray boxes to the right of the procedure codes are the modifiers. Simply click on them and you get a list of the modifiers. You can choose up to 4. In other words, if I click one here, click one here, click one there, you can see it highlights 3 of them. If I click on 4 and try to click on another one, if I misselected one, I can go ahead and click on it again and it removes it. When I'm finished, click OK. Highlights it in blue to let you know you have modifiers. And of course, when you hover over it, it shows me the modifiers. When I check this, by default, whatever I check first, that's going to be the order of the procedure codes and diagnosis codes here. Down in the lower right hand corner and click on the reorder button. As you can see, the procedure codes are listed over to the left and the diagnosis codes are along the top. The burgundy box is the modifiers, and modifiers are those whether you're talking about portions of the body, left, right, top or bottom. You can select them, unselect them here as well, and click OK. The units, you can change and say I need 2 units of this procedure code, so if the total charge for one procedure code is $150, simply by upping it to 2, now the charge will be $300. Next, the diagnosis codes. I can go ahead and select one of them and say, this diagnosis code I'd like to appear as the first for this procedure code. If I make a mistake, simply click on it again and it disappears. Or I can have it as number 3, select the third diagnosis, have it as number 2, and the first one as the first. When you're finished, click OK. You can also add procedure codes on the fly if they're in Advanced MD but not on the charge slip, by either clicking on the ellipsis button here, and also the same for the diagnosis. Click the ellipsis button, pulls up the list, simply double click on one, it automatically has it checked and ready for us to process. I'll go ahead and remove it by deleting it. And at this point we could go ahead and process the charges, and what that will do is it'll actually post the charges to the patient here, which is Ben Franklin. It'll post the charges accordingly. If Ben Franklin has insurance, it'll put the portion to the insurance as the responsible party, and also vice versa if the patient's responsible. And we'll learn how to take a look at that a little bit later on. The last section over here is optional. It's called the recall section. The doctor, if you'd like to see Ben Franklin back in a couple of weeks for an appointment type, maybe as a follow-up, click the drop down arrow, choose follow-up, and then set it out to, let's say, 2. Click the second arrow, weeks. Click Save, and it'll pull over here. Now this does not schedule it to the appointment scheduler. This is something that the front office will have to keep an eye on. For example, when I go ahead and click process, it'll post the charges here, and when it's done, Ben Franklin will be removed from the list here. It'll also generate a place in the report, and I'll show you which report you can pull up to do follow-ups. So we process the charges, patients disappeared, close out, go up to the reports menu, down to appointments, and then over and down and click on recall visits. Now today's date is December the 9th, and if I want to generate a recall list, if I only select today's range, Benjamin Franklin won't be pulled at all. If you recall, the doctor, we scheduled him out for 2 weeks from today's date. So for the low date, I can select today, but for the high date, because he's scheduled out 2 weeks from today's date, I'll do 3 weeks to be safe. That's the only way I'm going to be able to pull him in. After I click the Generate button, there I have Ben Franklin. And his recall date is December 23rd. So what I would do as the front office is anytime if the doctor or whoever's posting charges does those recalls, make sure that when you generate these reports, you set it out to 3 weeks, 4 weeks, a month, 2 months ahead of time. Then you'll have these and you can say, well, I got 2 weeks, maybe I'll call Ben Franklin next week or 1 week before his actual recall day to see if we can schedule an appointment then.